Your work week begins like every other week. Pressure to get things done, hectic busy hours, quotas, deadlines, and staff meetings. At the end of the day, you head home for a needed and relaxing evening with the family. Dinner and quality time with the family. And at the end of the night, you tuck your kids into bed, and now it's your turn. Time for you and your partner to get some needed rest. You head to bed, get comfortable, and pull the covers up. Time for some quality sleep. What happens next may surprise you. As you drift off, instead of having a relaxing night of needed sleep, you begin to snore. And soon your partner wakes up. Your snoring continues to get worse. That's because you've fallen into a cycle of snores and holding your breath, often gasping to catch your breath. You begin to deprive yourself of oxygen to your brain, and you don't know any of this has happened. This process is repeated over and over, hour after hour, all night long. Part of this problem is as you relax, your air passage begins to slightly close. There's a name for this process. The acronym is OSA, obstructive sleep apnea. Many in the medical industry call it the silent killer. A closer look at what's going on inside your body will show your breathing as you sleep. Your tongue and your throat relax, and then your normal breathing cycle stops. Breathing is reduced, often blocked. Your brain signals to your body that it's not getting enough oxygen. Then you gasp for air. Your brain is deprived of needed oxygen, which makes your lungs and your heart work harder. This cycle is repeated over and over, often hundreds of times a night. Sleep apnea is very dangerous, even be fatal if left untreated. And sleep apnea has many dangerous side effects, like cardiac problems, strokes and heart attacks, diabetes, impotence, daytime sleepiness, high blood pressure, and much, much more. All of these damaging to your body and your health. So, what can you do to solve your sleep apnea? Well, thankfully, there are options for you. Everything begins with a sleep study done by a qualified sleep professional. Your sleep study must be done by an MD. However, there is no need to be concerned. We will be happy to refer you to a qualified sleep specialist. If your doctor determines that you have sleep apnea, they'll likely recommend you wear a CPAP. If you cannot tolerate a CPAP or you don't want to wear one, don't despair. Thankfully, advancements in dental medicine offer alternatives to patients who can't or don't want to wear a CPAP mask. Your physician just needs to let us know in writing that you are unable to wear a CPAP mask for whatever reason. If you have been diagnosed with minor or moderate obstructive sleep apnea and choose not to wear a CPAP, you can be evaluated for a sleep appliance. Dr. Whitsett will review the results of your sleep study once it is provided by your physician. Dr. Whitsett has met certain criteria and completed hours of continued education in this area of dental medicine. Dr. Whitsett is a qualified dentist. This means he is board certified and has met the requirements of both the Academy of Dental Sleep Medicine and the Academy of Sleep Medicine. Then Dr. Whitsett will evaluate you for a dental sleep appliance. He will give you an oral examination to make sure that you are a good candidate for a sleep appliance. Our office uses advanced technology to carefully scan your jaw and mouth. Your results will be sent to a lab. This way, Dr. Whitsett can see exactly how your jaw is positioned. You'll be fitted with a sleep appliance that aligns perfectly with your mouth and jaw. Dr. Whitsett will continue to make adjustments until your appliance gives you the mental improvement you're looking for. Your snoring will be greatly reduced and your breathing much improved. and more than likely your sleep apnea will be reduced to a safer level. Patients who are a good candidate for a sleep appliance speak highly about the quality of their sleep. For example, here's what one of our patients recently shared with us. Hi, my name is Miranda O. This is one of the best doctor offices I have ever been to. After suffering for years with severe TMJ and sleep apnea, Dr. Whitsett was the first doctor to properly diagnose both of my issues and successfully treat them. I highly recommend this office. Lastly, once your appliance is fitted and working properly, we'll ask you to visit your sleep doctor one more time. They'll make sure that you're getting the maximum benefit from your sleep appliance. To learn more about sleep apnea and having a sleep exam, ask Dr. Whitsett or any one of his staff. They'll be happy to answer your questions or set you up for an examination.